Before closing their borders and locking down their citizens, many world leaders downplayed the new virus that was sweeping the globe.
In terms of a death toll, a pandemic would rival even the gigantic wars of the past.
When a virus jumps from an animal to a human, it's called a zoonotic virus. And for decades, these kinds of new viruses have been causing more and more outbreaks, hundreds. These outbreaks caused panic around the world for a brief moment. But experts, they stayed worried.
It is a pandemic.
The cases continue to increase globally. What we need to do is flatten that down.
We're going to have outbreaks in developing countries that are just going to be raging.
The official name of this virus is SARS-CoV-2. COVID-19 is the name of the disease it causes, which stands for Coronavirus Disease 2019. Going about their life, a person with this coronavirus likely infects a couple other people, and each of those people infects a couple more, and so on and so on, which is why the number of cases increases on an exponential curve, doubling every several days. In one U.S. sample, around 3/4 of people who were hospitalized had at least one underlying health condition, like lung disease, heart disease, or diabetes. It's impossible to predict all the ways a virus might evolve. Scientists believe this one may have mutated in another bat, or it may have jumped to another species before jumping to us, like the bird flu. And somewhere in this range was the 1918 combination. It was airborne, meaning the virus could hang in the air, infecting anyone who inhaled it. We can end pandemics. We've done it before. In the 20th century, we discovered antibiotics. So the bubonic plague and all these other bacterial diseases became far less deadly. Their immune systems have learned to recognize the virus and fight it off. When that happens in enough people, it's much harder for the virus to spread. This is called herd immunity. The rate of infection slows.
And the virus dies out.
So the best we can do is slow it down, using a method that's a lot more old school. In fact, it was invented 7 centuries ago during the Black Death, quarantine. Or its gentler cousin, social distancing. Avoiding crowds and close contact with other people so the virus has fewer chances to spread. South Korea is one model. As of early April, they'd managed to rein in their outbreak without a lockdown by testing widely and retracing the steps of people who came back positive. For other places to pull off something similar, they need to ramp up their testing.
We could be far more ready for a pandemic like a flu or a SARS. However, if a really fast-moving respiratory pathogen came out, no, we wouldn't be able to hold those numbers down.
And our healthcare systems obviously weren't prepared. Doctors and nurses around the world have been forced to use makeshift masks.
Together.
We know what it takes, because we've been in this race since life on Earth began, and a virus hasn't beaten us yet.